Thank you, Madam Mayor. I'm obligated to present the Director of Public Health's annual report and to provide a commentary as to the administration's policies in regards to its findings. First of all, it's clear a weak primary care network is driving people towards A&E, and A&E is being inappropriately used as a result. For example, A&E attendances that only required either minor or no significant interventions accounted for almost 83% of all admissions to A&E in 2014-15. To make matters worse, out of these 24,000 admissions, over 600 were via ambulance. That means almost a quarter of these people who neither were an accident nor an emergency were taken via ambulance. And that is a tremendous stress on the system. But it is also clear that often unpalatable change can be a positive thing if we focus on patient outcomes. For example, the closure of the Grays Walk-in Centre. It was an unfocused service, not a very scientific service. Instead, money has been put into the out-of-hour health hubs in the borough. 4 hubs open in evenings and weekends, more accessible to working families. That has created thousands of GP appointments. It's that type of work that will ease the burden on A&E. So what are we doing with these findings? Well, we passed the GP standards plan. We now have resources and staff dedicated to driving forward primary care improvement in the same way that we used to approach school improvement. We wouldn't tolerate a bad school for children, nor should we tolerate bad primary care. For example, using the outstanding public health data, we can model those who end up in hospital following a heart attack or stroke, and we can track back their lack of diagnosis for issues like hypertension. We can actually pinpoint practices that could have and should have done more to prevent that health issue. In patient numbers, this equates to a missing almost 11,000 patients with high blood pressure who have not been diagnosed or treated and who are at serious risk of heart attack or stroke now. Analysis by the public health team suggests that 1 in 20 of these patients will have a stroke, and that diagnosing and treating an additional 10% of Thurrock patients with high blood pressure could save the NHS 2.3 million and adult social care 3.6 million in treatment costs, not to mention saving lives. That is why primary care must be and is job one for this administration. We've also passed children's centre reform. In line with our policy of fewer buildings and better services, we're saving money and getting it to the front line, saving money on building costs and management, delivering a 0 to 19 model where health and education services are merged, so we reach beyond the 75% who currently use these services, and we get to children who didn't even know that some of these services were available, because public health is truly embedded in the wider system. This in conjunction of passing our Healthy Lives contract, which I had great pleasure in approving this evening, a new multi-million-pound service that is going to be mandated to work with schools to turn around generational issues of poor health amongst some of our young people, opposed to just lecturing adults about their own lifestyles as we've done in the past. We will build healthier communities in the future, and that is the leadership we're showing. So where are we going? It's time to stop an obsession of just funding and focus on outcomes in the local NHS. We had a primary care crisis in Tilbury, where poor GPs with single-handed surgeries decided to pack up rather than face the pressure to improve. And that almost collapsed the system. Now compare that to Hattingate in Stamford, a big surgery with plenty of GPs, plenty of providers, so you can have those tough conversations about improvement without risking the collapse of the network. That is the system we need to move to. That is why this administration will finally make progress on these 4 health hubs. For too long we've had talk without actually delivering, and we are now acting. I can announce tonight that I will soon be meeting with the project managers who have been appointed jointly by my team and the CCG to write the business cases to finally get work on these hubs underway. This is in addition to the changes I will make to the Health and Wellbeing Board in March to establish a proper delivery arm to take forward our primary care vision. Finally, it would be remiss of me not to thank my public health team. The Children's Centrepiece and Healthy Lives contract alone will not only build strong services, it will save millions of pounds, money that can be used for the front line because of more efficient use of contracts, because of truly innovative work. So my tremendous thanks to Ian and the entire public health team who are doing a fantastic job. Madam Mayor, showing leadership to improve primary care and leading the health market is how I and my team will build a stronger Thurrock and end generational issues of poor health. That is our vision. I'm happy to open to questions.
Extremely impressive report and gathering of data, which really allows us as councillors to understand what our residents are going through and what we need to do to help them. I'd like to ask the portfolio holder, bearing in mind the huge pressures on GP surgeries, I can't understand how closing a walk-in centre and restricting people's access to a health professional can improve residents' access to healthcare. So I'd like to ask what he will be doing to ensure Thurrock residents can access essential primary care through their GP and thus restricting them from going to hospital in that first instance.
Obviously, a question written before listening to the speech. 4 health hubs that are already active, evenings and weekends, providing GP appointments for those who frankly aren't around in the day to visit their GPs. That's already been delivered by the CCG. It's doing a great job. Sorry, you're shaking your head, you're saying I'm not right. No? That's already been delivered. And the reason we passed the GP standards plan is because that some of the primary care network is weak. So it's not just about the volume of care you've got, it is about the quality. Look at the report, it is clear that the better pathways you have for patients, the better the outcomes. So it's not just about the quantity, we are addressing the quantity, that's why you've got the 4 out of hours hubs. That is why this administration is going to get work done to actually build the 4 health hubs. The 4 health hubs were spoken about the last administration, not a single spade ever went in the ground. So we are delivery, Councillor.
Councillor Snell, do you wish to speak?
Yeah, thank you, Madam Mayor. Thank you for the report, James. And again, I also echo the praise for Ian and his team. The work is frankly spectacular in this. I mean, it's astonishing to know that before Ian started undertaking this work, we had no baselines for anything at all. We had no idea what the problems really were. We was all guessing it by and large. And Ian's managed to pull together a set of figures and a set of circumstances where we can see where the problems are and we can see where we need to get. And that is brilliant. This report is going in the right direction. You know, we do need to be proactive, and James is right in what he says. You know, it's no good just like continually promising things without delivering. We do need to start delivering. And I'm confident that with this report and the work that's being undertaken right now, that will be forthcoming. So that's all good stuff. But bear in mind that the report itself does say that some of this is going to take time to achieve. Obviously, we know that. That's not a great surprise. And other parts of it, you know, even if we can achieve just 10% of some of the recommendations, we're going to save a lot of money. We're still looking at a deficit over the next 3 years of 18 to 22 million. Are these plans, do you think, going to tackle that? Is it reasonable to assume that we can negate that deficit over the next 3 years with the plans that we've got in place at the moment? Thank you.
Thank you, Councillor Snell. First of all, you're right about the fact that there was no baseline. It was very courageous when the Secretary of State chose to give public health responsibility to local government. Lots of local government resisted it, saying it would just be an unfunded mandate, but clearly us having the local data on the ground in the communities that we actually understand, it works. Data is power, and it works. Now, in terms of the deficit, one of the things that I find frustrating as portfolio holder for health is that there is so much funding in the system that we frequently find in the wrong places. So if you look at the work that we're doing in primary care, we are trying to strengthen patient pathways themselves. So deficits are driven by pressure. So look at A&E. 83% of people who, by and large, were neither an accident nor an emergency. A&E is accident emergency. That is what it's there for. Now, if you're going to A&E because you want dressing changed on a wound, that is something that can be conducted by primary care locally. Fundamentally, that deficit can never go down until primary care is improved, because you can do clever things with hospitals, and everyone likes to talk about hospitals because they're the big institutions, they're the institutions with the biggest budget. It's the sexy thing everyone wants to talk about. But the reality is, you need to look at the far more simple primary care network. Until we fix that, the deficit will never actually be gotten under control. So just pumping money into hospitals isn't the way forward. It's this route. It is taking the primary care network, expanding it in terms of the fact that we are an under-doctored population, but improving what we've currently got, and also looking outside of the traditional healthcare structures. So the reason that when we put forward the reforms to children's centres, the reason we merged public health with education services is because poor education outcomes frequently begin poor health outcomes. It is completely linked. So getting public health embedded in the education system, which I'm confident we have now got right, that is all going to go forward to addressing the low-level issues to make sure they don't escalate, and that is how I really deal with the deficit.
Councillor Canade, do you wish to speak?
Addition just to what has been said about Tilbury and the issue of the GP, lack of GP. I know something is being done. I'd just like to know what's the update on that, if you don't mind.
Thank you, Councillor Canardi. First of all, it wouldn't be right if I didn't acknowledge your position as acting leader of the Labour Group this evening. My heart does bleed for Councillor Garish. The seat's right there, it's open, and somebody else speaking to it. It's tragic. Tragic. In regards to Tilbury, the reason we need to drive the changes to GPs specifically is because what happened in Tilbury was not due to any crisis in medicine. What happened was you had a collection of GPs who were there for a very long time. They were not the best practices. They were old contracts signed under the last government largely. So you had single-handed providers. And frankly, when pressure was put on them to say you will improve, they said, no, we're walking away. And it created a system that was so fragile, there was no strength in it. So it was very, very easy to collapse. The construction of the health hub is vital. You build new facilities, bigger facilities, you attract new young GPs into it. That's the future for Tilbury. That is why the council, working hand in hand with the CCG, has brought in somebody to write the business plans, because when I took over this portfolio, I'd spent a year, 18 months, hearing about the wonderful new things we were going to create, and we were still no closer to fruition. So I can assure Councillor Canardi that the good folk of Tilbury will be seeing an awful lot of me over the next 6 months.
Councillor Garish.
Thank you, Madam Mayor, and thank you, Councillor Holden. Madam Mayor, I think we certainly welcome many of the aspects of this report, and I think there's a lot of very good work here from the health team, and I think gives us a solid foundation for much of the work that needs to happen, both in Thurrock and across our partners in the coming years. Madam Mayor, there are some points that I would like to drill into a little bit further. First of all, the report does highlight the issue of avoidable A&E attendances. Now, while I obviously agree that that should be reduced if possible, I'm somewhat concerned about some of the implications in the report. Page 15 makes clear that patients aged 0 to 5 years old are the biggest source of avoidable conveyances. In other words, parents with babies or very young children who are concerned enough about those children to rush them to A&E. Page 16 also makes clear that the primary reasons for these attendances was the belief that they needed to be seen immediately. It also makes clear that little could be done in terms of patient education, and that refusing entry was the only intervention likely to prevent A&E use. Finally, Madam Mayor, the quoted financial opportunity at page 25, 2.7 million, is given on the assumption that every single one of the people who didn't require treatment or required treatment elsewhere would be refused entry. So in other words, this would impact parents who are worried enough about their baby or young child to take them to hospital to be seen immediately, and that the report advocates refusing at least 2/3 of them entry, even though in the majority of cases they do require some treatment, and sending them away to seek help elsewhere. Madam Mayor, while I do support very many of the measures in this report, this does give me some cause for grave concern, and seems to introduce a risk around the care for our youngest children if we task healthcare professionals with trying to turn away the majority of those cases. Madam Mayor, I'd ask the portfolio holder whether he would commit in the first instance to targeting only to use education support for parents with young children to make better choices on when to engage with A&E rather than calling for a hard refusal of entry, and whether he would be willing to carry that into the principal's document rather than the hard refusal as currently set out. Thank you, Madam Mayor.
Councillor Holden.
Thank you, Councillor Garish. It's always an absolute pleasure to be questioned by my dear chum. Slightly concerned that at the last full council, I suggested that Councillor Garish was seeking the leadership of his party, and the next full council, both the leader and the deputy leader are absent. Councillor Garish is starting to take on quite a sinister vibe. Now let's be quite clear. A&E is accident and emergency. If you've had an accident, go to A&E. If you're in an emergency, go to A&E. If you're had an accident, if it's an emergency, you can't get yourself to A&E, call an ambulance. Now, Councillor Garish talks about refusing access to A&E as if it's some sort of draconian, extreme measure. If you're a primary school pupil, you don't go to a college, do you? It's about an appropriate intervention. Now, take the education aspect that you mentioned. One of the things that frustrated me when you chose to vote against the Children's Centre reform, because of the way that we're merging education and health services to get the right care to the right people at the right time, is to make sure you've got that appropriate triage service, to make sure people do filter through the system in the correct way. We've got to prevent A&E from morphing into something that it's not. A&E is not a walk-in centre. The thing that was in Grace High Street was a walk-in centre, a very outdated model. A&E is not a walk-in centre. So when he talks about refusing people access to A&E, I want A&E to be there, so if someone's had an emergency, they go straight in. If someone's had an accident, they go straight in. And only by assuring that the appropriate triaging is there, reform children's centres, strengthen primary care, is the only way we can prevent A&E from morphing into something it's not meant to be and preventing the absolute collapse of the entire system. That is the way we've got to go.
Councillor Spillman.
Thank you, Madam. Firstly, if you give me an update on Aveley, because Aveley, I mean, some of the waiting times for GPs is just as bad as Tilbury, it's just the outcomes aren't quite as bad. I really like the concentration on education and lifestyle, and that needs to be incorporated. But from my perspective, there are some small children, a lot of small children that their parents bring them to me. That the only major problem with their lifestyle is that they've been born into Thurrock Council social housing that's got horrendous damp and mould, and they're getting respiratory problems as a result of that. Can the portfolio holder please look closely into the links between severely damp and mouldy properties and respiratory problems, and work with the housing portfolio holder to try and get a grip on this, because these are long-term, enduring illnesses that are leading to problems throughout people's lives. Thank you.
Thank you, Councillor Spillman. Well, first of all, on the lifestyles issues, you are right. We've got a whole range of contracts that we inherited from NELF, from the PCT, etc., that were bitty, not very efficient. And we were spending an awful lot of time lecturing adults about consenting lifestyle choices. If an adult wants to smoke, chasing them with a 4-week stop target isn't efficient. That's the system I inherited when this administration took office. The new healthy lifestyles contract that we've got in place, the providers, a single provider, will be mandated to work with schools. It's the schools who will see those issues on a daily basis, Councillor. The schools know the children who come from certain backgrounds. They will hear things from the parents. They will know what children end up sickly. So having a proper service that actually intervene at that early age is incredibly vital. And in terms of respiratory illnesses, I can't recall what page it is in the report, but that is one of the criteria for the GP balance scorecard that we passed as a part of my GP standards plan. It's looking at all the different metrics that you can get out of a GP surgery and look at the ones that are relevant. When myself and Councillor Little passed the clean air report, we referenced the GP balance scorecard because if you're holding GP providers to account and saying you've clearly got patients who are being underdiagnosed for lung conditions, you've clearly got patients who are not getting treatment quickly enough for lung conditions, you can actually do something about it. So I can absolutely assure you, respiratory illnesses are definitely one of the things that the standards plan is aiming to address. Categorically, myself and the leader have already discussed the issue on multiple occasions, and most certainly, if there are specific issues in your ward, by all means, please write to me, or I'm even happy to visit your ward with you.
Thank you. Right, we've got 10 minutes left and I've got 4 councillors wish to speak, so please want to make sure we give everyone an opportunity to speak. So if you could make your questions or your points as brief as possible, that would be most appreciated. Next councillor is Councillor Collins.
Thank you, Madam Mayor. Just a question to portfolio holder, just to make sure they're actually clear. Are there any existing GPs in Thurrock who are willing to work with you in reforming the service they offer to the people of Thurrock out of hours? Thank you.
Thank you, Councillor Collins. A number of GPs are extremely hard working. One of the great benefits the borough has is College Health. The health provider that I compare to the Harris Multi-Academy Trusts that runs many of our schools. College Health are a great outfit. They've taken over what was the Shahada practice in Grays. They are outreaching to other surgeries and helping them to improve. That is why when the medical centre in East Tilbury was threatened with closure, College Health is the provider there, and frankly that's one of the reasons that I judged that intervention to help attempt to save the centre was appropriate. College Health are a great outfit. We want to encourage more groups like that into the borough by showing them we're firmly on their side. So you're right to raise it. Yes, we do have some excellent GPs who are working with us.
Councillor Gledhill.
Thank you, Madam Mayor. Just a couple of statements. First of all, declaration of interest is non-pecuniary one. I am the chair of the Patients Participation Group of a surgery in Tilbury. One of the surgeries that's been mentioned that did fail, and it's second from last CQC. It's had a recent CQC. I'm still waiting for the official outcome of that, but I'm just going to say I had a smile on my face. Councillor Snell hit the nail on the head earlier with this. We can't fix what's broken until we actually know what's broken. This report really goes a long way. We know where the problems are, we can address them. Yes, it is education. And as Councillor Horner said, many people with high blood pressure are being missed out of the system. And I really would urge everybody to go for that GP-based MOT. I'm not going to crack any jokes about my big end going, and my doctor cracks that one every single time. I found it funny the first 15, but not since. I'm going to address Councillor Spillman's issue with the respiratory problems. Not the last one, the
Councillor Gledhill, sorry, your question.
No, just say it's a statement. It is being addressed. It's not just outcomes for health, it's also outcomes for education and employment. That's why we need to address it.
Report, Councillor Horden. It's quite an impressive report, it's quite a detailed report, and I'm sure the public health team are basking in the glory for that. It's a really good report, thank you. I do have some slight concerns about it, and I think there was just minor things. And I think what would have been really useful was to actually have an analysis of the impact, or not, of the closure of Grays Walk-in Centre on Basildon A&E. We do know that obviously a walk-in centre is slightly different to bookable GP appointments, and while we all welcome bookable GP appointments, it is different to my child has just come down with an earache, I need to get them somewhere on a Saturday afternoon to get them antibiotics. That situation very, very frequently myself. Grays Walk-in Centre was godsend. It was next to the train station, next to the bus station, and it was a very well-known service. People knew it existed. My concern about current out-of-hours provision is, before I got involved in the campaign with the Walk-in Centre, was that I didn't actually know about out-of-hours. So there does need to be some more kind of publicity for that, and I'm sure you've got plans for that, Councillor Horton, so if you could share those with us, that'd be lovely. The other thing I would like to just confirm is your definition of out-of-hours, because you've mentioned some work around out-of-hours care. When the CCG took the decision to close Grays Walk-in Centre, they said there would be out-of-hours GP appointments that were bookable. That turned out to mean 3 hours on Saturday morning, which obviously was not a like-for-like exchange for the walk-in centre, which was 8 until 8, 7 days a week. So I just want to clarify whether these new hubs are going to actually have any kind of urgent care facility to try and relieve that pressure on A&E, and if they are going to be operating in a sort of fully rounded out-of-hours service, or is it going to be sort of slightly more restricted? Thank you.
Thank you, Madam Mayor. Thank you, Councillor Apothecary. Frankly, if I knew Mr. Wake and the public health team wouldn't get so much praise, I probably would have kept them for back of house. My show. It was. The Grays Walk-in Centre is an example of what happens when funding is in the wrong place. My example of 83% of attendances at A&E that did not require major intervention or intervention at all, that figure is 14-15, while the walk-in centre was still open. So A&E was already under unbelievable pressure with facilities like that open. You can't keep doing the same thing over and over again. It doesn't work. So that is why we need to move to the hub model. The example she's giving, the hubs were a new concept, very late 2015, early 16, in terms of the out-of-hours hub. In terms of the 4 new hubs that we're going to be creating, the exact timetable is going to be based on the GPs we attract to it, and it's also going to be based around the types of contracts that we sign with GPs. We can't have more of these contracts that were signed by the last Labour government, but unbelievable terms, and frankly outrageous, slanted towards the health profession rather than slanted towards patients. We can't have that again. That is why one of the changes to the that I'll be taking to the Health and Wellbeing Board, the group that will be established to drive forward the GP standards plan, drive forward the scorecard I'm talking about, that body is also going to be providing commentary to NHS England in regards to the type of contracts we want signed, the type of specifications we want in health tenders. So when we can say we've got respiratory illnesses in Avely, we need to make sure that our medical care caters for those types of issues. We can make sure the tender that is signed reflects that, rather than the old system where that's what causes the type of issue you're talking about, where you can't hold providers to account, you can't make them work out of hours if they don't want to, you can't make them work at weekends if they don't want to. We need stronger focus on these specifications. And in terms of getting the A&E demand down, as you said, Basildon Hospital are working hard and looking at the possibility of creating a step-down service to get people out of hospital. As a council, we're looking at improving primary care itself, or we could do what I gather the Labour group are taken to doing, standing on street corners with signs saying, "I heart the NHS." Novel approach.
Councillor Head.
Thank you, Madam Mayor, and Happy New Year. A bit late, Happy New Year to you and everybody else in the chamber. I want to raise, or go back to the point that Councillor Gerrish raised, which I empathise with regarding the education and the communication, but I have to struggle to agree with it. I think it's incumbent on everybody who is aware of how to access the systems in the right and meaningful way does so. So there is the 111 service, and having been a user of that service, going back to Councillor Apothecary's point, I've got a young daughter myself, the first time she woke up with croup, and I dare say there's a few parents in the room that knows what that's like, my God, I thought she was going to be breathing in 5 minutes, it was dreadful. But by ringing 111, I got a clear pathway to the right service and right access, and she was dealt with in the best possible way without going to accident emergency. Because unbeknownst to myself, I'm no doctor, no quack, it wasn't actually an accident emergency. It was just a harrowing experience. So I think it's incumbent on all of us that know that services like that, like 111. There's 49 community leaders sitting in this room tonight, as well as, it's not only public health's job to do this. This is us as well. And what I think might be appropriate, Madam Mayor, is if we look at the monthly email, Karen, about perhaps publicising some of the right pathways and whatnot, and I think that might support partly what you're saying, Councillor Gerrish. We can have a role as a council in making sure the right communication and education gets out there to support people's pathways to the right access to service. So I think we'll go with that for the next email, Karen. All right?
Thank you, Councillor. If we go to page 51, the recommendations, there are 5 recommendations. Are members in agreement with the recommendations in the report?
Agreed.